Welcome back to Inside the Owls Burrow. I'm Frank Fort. When it comes to sports medicine, not only the FAU football team, but the athletic department as a whole is in good hands, thanks to a partnership with Boca Raton Regional Hospital and the team physicians. Tell me a little bit about the relationship between Boca Raton Regional Hospital and Florida Atlantic University Athletics.
For the past 5 years, Boca Raton Regional Hospital and Florida Atlantic University they've had a relationship with each other. They established a good relationship to provide medical care for the student athletes. And 5 years ago, that started with a couple of other doctors in the community. And now myself and some of my partners in the practice, we're part of Boca Care, which is Boca Raton Regional Hospital's physician network group. We're slowly coming in and helping out as well. And that contract's been present for the last 5 years and is continuing, and we have a very good relationship.
Sports medicine has become a very specialized field over the last decade or two. How does that differ from general medicine?
General medicine is a big part of sports medicine as well, but the athletes are a special person. It's like a geriatrician that takes care of elderly or a pediatrician that takes care of kids. Athletes have special needs that differ from the regular population, and so we gear our treatments towards getting them back onto the field healthy and safe and as quick as possible.
And clearly you're dealing with college student athletes, and their families have concerns. They want to know that their young men and women are being well taken care of. So that's sort of another part of it that, yeah, we want to assure the parents that they're in good hands.
You know, I love talking to the parents. I think it's great to have the parents involved in the student athletes' care whenever possible. And our athletic training staff here at FAU does a really good job of communicating the plan of care with them. But when needed, we have parents come into the training room during our clinics and we talk to them about what's going on. And it's a good relationship.
I'll use the general term team doctors, because that's the way it's kind of been. What are some of the benefits of being a team doctor in terms of attending games and being around the events?
Well, obviously, being a team doctor is fun. You know, we all go into this because we have a special interest in athletes and treating athletes, but one of the perks of being a team doctor is, you know, getting to go to the games and watch the games, though it's not, you know, we're not there for fun. We're there to watch for injuries and make sure that, you know, the kids are safe when it's time to go back in. But attending the games, being at practices, coming into the locker rooms, you know, it's fun. A concussion is a functional injury to the brain, okay? And it can happen when somebody takes a hit to the body, takes a hit to the head.
A big topic these days in football particularly is concussions. And although there have been advancements in helmets and protection, there is a concussion protocol that is now in place, which, you know, 15, 20 years ago simply wasn't there. It's a lot better in terms of A, diagnosing, and B, treating. Would you say that's correct?
Yeah, very much so. We've come a long way in terms of concussions in the last 10 years, maybe even more so in the last 5 years. We recognize concussions more than we used to, and we're sensitive to them.
As a team physician, when you're on the sideline, is that something you're keeping an eye out for?
Absolutely, yeah, and we also have specialized staff on the sideline that helps take a look out as well. So, you know, we're watching closely. Not only are we watching the game to see what happens, but we're watching the players individually, especially if we, you know, notice that there's a big contact. We're watching the players, seeing how they get up, what do they look like. We're sensitive to it. Where do you feel it? Feels tight.
Now, let's say somebody has a knee injury that requires surgery.
My partner, Dr. Ross, is the orthopedic surgeon for the football team, and he would evaluate the player, or I would, and if we both determined that eventually the player would need surgery, Dr. Ross would be performing the surgery on that athlete.
Do by and large athletes recover quicker from injuries than the general population?
Sometimes, you know, an athlete in mid-season who's working out all the time, stressed out from all the activity they're doing, their immune systems are actually down a little bit. So, whereas some people might think because they're stronger and because they're in shape, they may recover quicker, it's not always the case. Sometimes they need a little bit more rest than the general population because their immune system's a little bit down. When it comes to injuries to the musculoskeletal system, however, they heal just as quick as we do.
We'll get more into the surgical side of orthopedic medicine on a later edition of Inside the Owls Burrow. Coming up next in our Coached Up segment, we'll visit with cornerbacks coach Corey Bell. That's next on Florida Atlantic Football Inside the Owls Burrow.